Hello, today I wanted to talk to you about abdominal muscle separation, or otherwise called rectus diastasis. So abdominal muscle separation essentially happens to absolutely everyone during pregnancy because your abdominal muscles, or the stretchy band between your abdominal muscles, actually has to stretch to allow your belly to grow. Now, in terms of postnatally, what we do to assess an abdominal wall to determine whether there is a separation there and or how bad the separation is or how severe it is, we get you lying down on your back with your knees bent up, and what we actually do is we feel above and below the belly button, and what I'm feeling for is a gap or a separation. So I feel where the gap is when you're just resting, excuse me, and then I get you to do a curl up or a mini sit up. And what actually happens when you do a curl up is your six-pack muscles, they shorten, but they actually pull open. So if that stretchy band is weak, or you're quite early on in your postnatal recovery phase, the band will actually stretch and you'll get a increased intra-abdominal pressure, which will actually push up into the band, forming almost this sort of dome or this coning sort of effect. So I'm interested in a couple of things when I'm assessing an abdominal wall. Firstly, what does the abdominal wall look like? Are there stretch marks? Is there a lot of laxity? Is there lots of looseness in the abdominal wall? Secondly is to what extent does that coning or that bulge actually occur when there is an increased intra-abdominal pressure? And then thirdly, actually how far apart are the abdominal muscles have stretched. And yes, that's important, but from a physiotherapy point of view, what I find is more important is actually how well a woman can stabilise her abdominal wall and how unstable or how much laxity there is in the tissue and in that linea alba, which is a stretchy band between your six-pack muscles. The issue, if it is lax or if you're getting that coning or that bulging when there is increased intra-abdominal pressure, and what I mean by that is when you're getting out of bed or when you're lifting something up or when you're opening your bowels, they're all times where there can actually be increased pressure coming into your tummy. And if there is an element of laxity or looseness there between your six-pack muscles, I'm talking about, not just generally, what will actually occur is with that increased pressure, you'll see the cone, and that pressure actually starts to descend down onto the pelvic floor. So it's not only stretching and potentially weakening your tummy furthermore, it can be weakening your pelvic floor. So if there's increased movement at the front, unfortunately your back is going to have to do an awful lot more to stabilise, but also your pelvic floor is under an awful lot more strain to try and provide support to your entire thorax. So ultimately what happens over time with there being an increased strain on your back and on your pelvic floor because your abdominal wall is weak or unstable or lax or loose, is that you ultimately get more back pain, but also you can get pelvic floor weakness, which can ultimately lead to things like incontinence and prolapse as well. So what I advise women in terms of how to recover and how to get their abdominal wall nice and stable and strong again is firstly what to avoid. So definitely avoiding sit-ups, planking, all sort of traditional abdominal or abs exercises. Definitely avoid straining and being constipated like the plague, firstly because it's really uncomfortable, but secondly it just creates too much pressure into the intra-abdominal wall. And then thirdly, try to reduce as much as possible all of your heavy lifting. Now for those mums who have toddlers, that's a very hard one. So when you are lifting up your toddler, you've really got to make sure that you're supporting yourself from the inside out. And what I mean by that is using your pelvic floor and your deep motion systems to actually support your entire thorax and support that abdominal wall effectively. Secondly, the really, really important part of getting your abdominal wall back is getting a nice strong pelvic floor and deep motion system, which includes your core muscles. And that's not just your six-pack and your obliques, it's actually a lot deeper than that. So it's through transversus and lots of different other muscles that actually form this beautiful absorption system within your body. You must learn how to reuse this system after having your baby, because with all of that extra force and pressure generated within your tummy when you're pregnant, but then go on to have a vaginal delivery or then go on to have a cesarean delivery, those systems tend to be not damaged, but they certainly tend to be a little less effective. So what I actually strongly recommend is come in and have a pelvic floor assessment to see where is your pelvic floor at, where is your core at, where is this abdominal wall at. We can then give you an idea of what specific exercises to actually start practicing in order to strengthen your pelvic floor and that deep motion system so that you can ultimately strengthen your abdominal wall and get those muscles back together again.